This next adjustment is a seated reinforced hypothenar proximal radius pull for an A to P glide restriction of the radio-ulnar joint. In this adjustment, it's a seated adjustment, so my patient is seated. Doc, you're going to sit next to your patient here, and then you're going to have your patient sit on their hand, palm up. Okay. We know now that the radius is forward here, so we'll palpate on that radius, and then I'm going to use a little bit of a tissue pull with this adjustment. So I'm going to take tissue from here, and I'm going to push it forward, and then I'm going to grab a hypothenar contact and continue that tissue pull. Basically, I'm rotating over to the side of the radius. So I'm tissue pulling over so that I can kind of set up right on where that radius is. So we tissue pull over. I'm going to stack my contacts so that I've got a reinforced hypothenar contact here. Now it's important that our patient will lean away for this style of an adjustment here. And then Doc, you're going to just provide a straight force, be anterior to posterior then on that radius. I want to draw attention to the fact that in this adjustment we are putting some strain on the shoulder. So we do need to make sure that our patient's shoulder is not symptomatic and that they don't have any sort of a pre-existing condition or some sort of a history of shoulder injury, where in doing this adjustment to correct a restriction in the elbow, we actually injure the shoulder. This adjustment was a seated reinforced hypothenar proximal radius pull for an A to P glide restriction of the radio-ulnar joint.